Welcome to this presentation. Today I'm going to tell you a little about the work we've been doing here at South East Melbourne Primary Health Network in relation to allied health consultations in aged care. We were asked to help make multidisciplinary care and access to allied health easier for residents in aged care facilities. Most of this information is most relevant to people working in aged care on the Mornington Peninsula, but if you work in aged care elsewhere, you may find some of the information useful. So what did we do? Well, from service mapping and consultation of people in the area, we identified 6 areas of concern. There is minimal referral to speech therapy services for assistance with communication difficulties, minimal referral to psychology and counselling for mental health issues, even though data suggests that depression and anxiety are common in aged care. There's lack of awareness of occupational therapy services and awareness of actual service providers in the Mornington Peninsula region. Poor uptake of reviews as suggested by allied health practitioners, meaning that residents may stay on treatment plans longer than required or necessary. There's variability of more junior care staff to identify early warning signs of deterioration, and some cases of inappropriate chronic disease management plans being created, often resulting in out-of-pocket costs for residents unnecessarily. In response to our findings, we developed the following strategies to assist people in aged care to identify and respond to the needs of residents. We hope that the tools provided help to identify the individual needs of residents and encourage a whole-of-person response to care. So what did we do? Well, firstly, we developed a map of medicine pathway. This aims to clearly articulate when and how to refer. I'll talk a little bit more about the pathway in a moment. We identified local service providers with capacity for in-reach consultations, and we clarified the 5 options for funding an allied health consultation in residential aged care. This is a view of the map of medicine pathway we created to assist facility staff to identify signs and symptoms that may appropriately be treated by allied health clinicians and arrange for an appropriate consultation. It includes a list of signs and symptoms as well as links to local service providers. You'll find the signs and symptoms in these boxes here, boxes 6, 7, 8 and 9, and specific referral information in boxes 10 to 15. This bottom section describes the 5 options available for funding an allied health consultation and provides guidance on who may be eligible for each funding stream and in what circumstance. If you would like to view this pathway live, then you'll need to register for the map of medicine. You can register by clicking under the Resources tab on the South East Melbourne Primary Health Network website and registering in the Map of Medicine section. I'll leave a link to this section of the website in the comments section of this video. While working with allied health professionals in developing the pathway, we grouped the triggers or signs and symptoms together and listed them. You can find a copy of the list and what allied health professional to refer to by following the link in the comments sections, but I'll show you a copy here. You can also find it on the Peninsula Health website under the Residential Outreach Support Service page. This document may be used as a quick reference guide for direct care staff at facilities who may not be directly related to the funding of allied health consultations, so may not need to view the entire pathway through Map of Medicine. You'll see on these charts that we've grouped the signs and symptoms into physical signs and symptoms, mobility, transfers, falls, aids and equipment issues, language, speech, communication and swallowing, and mental health and well-being, including cognitive and behavioural issues. As a quick reference chart, you'll see if you find one of these signs and symptoms, it will lead you onto what appropriate allied health referral to make. You can get a copy of this chart directly by printing off the internet from this page, or you can email us here and we can send you out laminated A4 or A3 copies. So let us know if you would like some for your workstations. We're aware that a large proportion of allied health consultations are provided by contracted organisation. Our pilot sites reported that even when they had contracted providers, local providers were able to have a quicker turnaround time in more urgent situations, rather than wait for the next routine scheduled visits of their contractors. Costs associated with allied health consultations. As mentioned before, there's 5 key areas, or key ways, I should say, in which a allied health consultation may be funded. The first is, of course, that much of care is probably going to be covered by your general ACFI payment after ACFI assessments have been completed. The second way is there's a possibility that may be covered by DVA or TAC or work cover. Private health insurance, for those who have private health insurance and extras cover, their allied health consultation may be covered or partially covered by this. Number 4 is the chronic disease management plans. This is really only an option for residents considered on the lower care of the spectrum. And I'll talk a little bit more about chronic disease management plans in a moment. And number 5 is that after consultation and consent that the resident may pay. Chronic disease management items. Chronic disease management items can be used with the following points in mind. Really, they're not for care that's already covered by ACFI payments. As I've already mentioned, they're designed for those who are traditionally at the lower care end of the needs spectrum. Chronic disease management items and allied health visits cover 5 visits in total per calendar year. That's not per discipline. So if someone's referred to 3 different allied health specialties, say OT, psychology, and podiatry, the chronic disease management items will only cover partially or in total 5 visits in total across that calendar year. The care plan itself must be developed by the facility, but the decision to use the chronic disease management plans for allied health visits must be GP-led, and the GP must review the plan, document this, and make the referral for allied health. It's important to note that even if a chronic disease management plan is in place, there may still be some out-of-pocket costs for residents. The rebate from Medicare is quite low, and so a lot of allied health clinicians don't do no out-of-pocket chronic disease management consultations. It's important to figure out what the costs may be for the resident before you sign someone up for these sort of consultations. I hope this has helped. For more information, please feel free to contact our program, and there is our email there on the screen. We would love to hear any ideas or suggestions you might have about how to make multidisciplinary care easier for people working in aged care, ultimately resulting in better care for residents. Thanks for your time.